Hello, good afternoon. This is Tara Gober with Greenway Health, doing a demo quickly of prime speech. What you're looking at here is basically the mirroring of my iPhone. So we're just going to kind of start with if you were using the speech application from your actual iPhone utilizing Prime Mobile. It will be with any smartphone, so whether that's your Android or your iPhone, any other smartphone that's out there, we can hook up to that. But I'll go ahead and start here. So I've pulled up a patient. You can see patient demographic information, allergies, clinical alerts, medications, a basic view of the entire chart top to bottom. Here from my actual mobile device, as I scroll through this, you can kind of see there may be a little bit of a lag time just due to the GoToMeeting, but we'll kind of go ahead and get started with the actual dictation piece. Here in just a second. So when I tap on Prime Speech, it allows me then to go ahead and select a document type. So for instance, if I was seeing a patient in follow-up, wanted to select a progress note, I can determine what parts of this note I'd like to bring forward. So maybe I want to bring forward his past medical history and maybe his problem list. I could actually bring those forward automatically, and then I can actually start my dictation. If I even wanted to bring forward a previous note, I have the ability to do that as well. So I'm just going to kind of roll through really quickly a quick scenario of an abdominal pain visit. So just bear with me, please. Chief complaint, abdominal pain, HPI. The patient is a pleasant 36-year-old male who presents on referral from Dr. Smith for evaluation of abdominal pain. The patient has described the pain as moderate and cramping occurs after meals. The pain has been worsening over the past 3 weeks and is located in the right lower quadrant. The patient has been using over-the-counter medications and is not seeing improvement of the symptoms. The patient admits to bloating, denies previous history of gastric illnesses. No previous diagnostic tests have been done prior to this visit. Review of systems, all systems are normal except as noted as in the HPI. Physical exam, vitals 120 over 80, pulse 80 and regular. The assessment today is abdominal pain, plan, CT of abdomen, ultrasound, return to the clinic in 3 weeks. And as you can see here, I've recorded the dictation. It was about a 46-second dictation, and then we just tap on finalize. And it's actually going to populate the phrases that I mentioned here into the appropriate section. So you'll notice if you can kind of see here on the screen, I might be able to zoom in a little bit. You guys can see chief complaint abdominal pain. It captured everything that I said here. What's nice is that, you know, this is kind of where you're going to see the value of Prime Speech and also the return on your investment, because the cost is much more affordable than probably what you're paying most of your transcription companies out there today. So it really captured everything. It also placed it in the right sections of the note. You'll notice that discrete data elements were automatically brought forward based on what we selected. So for instance, in the past medical history, I wanted to bring forward that he had a kidney stone, hypertension, and a previous PT was done. The review of systems, you'll notice there as well, as I dictated. And then you've got your vital, and then your assessment, and then your plan there at the bottom as well. So if you had any specific instructions that you wanted to include, that would be there also. So when I clicked on the checkbox, it can automatically, you can have that set to automatically close out of the application. I can jump right back in here. So this is kind of what the sign-in screen looks like. Put your username and password in, and it brings you to your list. So if you had a running list for the day, but then I'm able to look at my recent patients. If I wanted to search for a patient, I've got the option to do that here. So if I needed to pull up a different patient that wasn't on my list for that day, I could do that. Once again, it shows all the patient information, allergies, alerts, family medical history, surgical history, and then you just tap on Prime Speech to go ahead and start that dictation once again if you needed to. Keep in mind, if you just needed to make a quick note in the chart, you could select miscellaneous note and just start the dictation there. You can have this, you know, auto route to any particular person if you need them to proofread it. But really, you know, this is a speech understanding tool, so it's going to populate those elements in the correct fields. But of course, if you needed to go back and modify anything, you have the ability to do that as well. This then would send the necessary information over for billing. So that's that part of it. I'm also going to show you if you wanted to use an actual speech mic, what that looks like. So give me just 1 second. I'm going to kind of flip over to that. Okay, so now you're seeing the full application here. I'm using a tablet. I'm actually logged into the system right now. I know that Dr. Cohen has already seen me kind of go through a visit. You know, I could quickly pop through a visit to kind of show that functionality as well. But what you'll notice here is your patient list for the day. Any patient that is here and checked in will be in gold. If I wanted to select a patient, all I have to do is tap on that patient's name. I'll kind of run through that dictation if I were using a speech mic, but before I do that, you'll notice just a few things here. You've got customizable flags and alerts. You can determine where those show in the chart. You can also determine if they just show at the top here or if they're an actual pop-up like you saw before. So all of that's customizable. When you're looking at this patient face sheet, another great thing about Greenway is that it is completely customizable as far as structure goes. So if my nurse or MA wants to have past medical history at the very top of this page, you know, basically all they have to do is just drag and drop that to the top of the page. Everything is going to be user specific, so I'm logged in here as myself, so these settings will always save for me. I could see the patient's picture. If we had a picture uploaded, you'd be able to see that here. What's great about this is it is also customizable. So maybe I just want to see their picture. Maybe I also want to see their name. So with just a couple of quick clicks, you're able to see exactly what you need. So maybe as a provider, you want to know, where am I sending that patient's medications to? So this is a very simple system as far as customization goes, and it's just, you know, you're always a click away from everything. But anyhow, I'll kind of jump into looking at a note. I could just select Create Dictation, and then if I was going to do an H&P note today, maybe it's a consultation note, whatever it is, you can select the appropriate note type. This is where you do have the ability to bring forward previous information from the patient's chart. So with one click, I could actually bring all of that forward. Or if I wanted to, I could just pick and choose what pieces of that note we wanted to bring forward as well. So I'll go ahead and start dictating from here, and I'm using a Philips speech mic, and we have wireless versions of that, or you can use the ones that are also connected to the tablet as well. Acute complaint, abdominal pain, HPI. The patient is a pleasant 36-year-old male who presents on referral from Dr. Smith for evaluation of abdominal pain. The patient has described the pain as moderate and cramping occurs after meals. Pain has been worsening over the past 3 weeks and is located in the right lower quadrant. The patient has been using over-the-counter medications and is not seeing improvement of the symptoms. The patient admits to bloating and denies previous history of gastric illnesses. No previous testing have been done prior to this visit. Review of systems, all systems are negative except noted as in the HPI. Physical exam, vitals 120/80, pulse 77 irregular, well-nourished, well-developed patient, abdominal exam, abdomen soft, diffuse tenderness, palpitation present, bowel sounds normal, no mass present. Assessment, abdominal pain, plan, CT of abdomen and ultrasound, return to clinic in 3 weeks. And then you'll notice here it automatically populates it just like you saw on the mobile device. You'll notice acute complaint, abdominal pain. What's nice about this is if you wanted to, or if this was being routed on to someone else to review and then sign off on, this is even great if you think about any PAs that might work at your practice, having that then routed over to you for approval, you can actually play it back. Acute complaint, abdominal pain, HPI. The patient is a pleasant 36-year-old male who presents on referral from Dr. Smith for evaluation of abdominal pain. The patient has described the pain as moderate and cramping occurs after meals. Pain has been worsening over the past 3 weeks and is located in the right lower quadrant. The patient has been using over-the-counter medications and is not seeing improvement of the symptoms. So basically it just kind of allows the system to then track that by each word. And one thing that's different you'll notice is that the system is not actually, you know, putting the text up on the screen as soon as you dictate. So if you've ever seen Dragon, for instance, it's just voice to text. With this, It waits until you're done with your complete dictation set, and then it populates it on the screen. It's great because if you make a mistake and say you wanted to select something or change something, you have the ability to use the voice commands to do that as well. So if I wanted to, I could say, select that, and then, scratch that, and modify that, cut that, whatever. So it allows you to get all of the words on the page and then make your corrections if necessary. So this is a completed note. If there are certain pieces that you wanted to send over to a referring provider, keep in mind you have the ability to do that, and we kind of went through that with Dr. Cohen a little bit, but I could just tap on Save and Sign, and then if this did in fact need to be routed automatically over to another individual to review it or make a change to it, you can have this auto route function set up here, and then when we click OK, that then goes to that user's task list. So maybe you wanted to have your nurse or MA route the correspondence letter out to their referring provider after you're done with your dictation. If I'm the nurse or medical assistant, I just received the task, and I've got the ability to then grab that task. And then if I wanted to, I could actually open up the chart or just open up the note and then route that via electronic fax over to the referring provider if that was kind of a part of your workflow. Okay? Okay, hopefully that was helpful. I am happy to kind of go through another quick note if we weren't dictating. So if I was just going to quickly kind of roll through a templated note, what that would look like that's just a little bit different really here is just clicking on Create Note, selecting the note, whatever that note type is. Maybe your nurse or MA has already filled out part of this for you, so they're going to have the ability to come in and say that they were having burning with urination. Keep in mind, any place that you see a microphone, you can dictate. And then let's say that you wanted to look at their previous note. You've got the ability to import a document from a previous visit. So what's great about this is if I wanted to look at his previous hematuria visit, I've got the ability to do that. And our notes are very concise. Once again, you can pick and choose what stays in a note. If you wanted to exclude the physical exam, you just wanted to send over the assessment and plan, you have the ability to do that as well. But I'll go ahead and just select a template so you can see what that looks like. What's nice is that you can pick and choose what parts of the note you want to bring over. So if I click on Select Template, I've got the option to then select from a pick list of templates here. Maybe I wanted to share templates with other users. I've got the ability to do that as well. And then I can just kind of populate the note as we go through pointing and clicking. All of these are customizable sections, so they can all be changed, and you can also change anything that you'd like to on the fly. So if I wanted to start dictating here, I could. Vitals will flow into the note automatically, so I'm kind of skipping around here, but you can see that the nurse or medical assistant captured those, and they're automatically going to populate your note for you. If something's abnormal and you want to indicate that here in the physical exam, it will always show in red and in italics for you, so that when you look back at that note, you have access to anything that was abnormal with that visit. This is just like selecting on a super bill the reason that the patient was here. So you will have different codes available to you. We are ICD-10 ready. So you'll have the ICD-9 code and the ICD-10 code listed here. If you wanted to add something that wasn't a part of this template, for instance today, so maybe they were having some associated abdominal pain, I can just start texting, and then a list would actually populate to allow me to pick the correct code there. Keep in mind all of your codes will be built in. I know that Dr. Cohen had that question, but these are just kind of template specific. But also if you just wanted to start texting on the fly, you have the ability to do that. So this particular order set is what automatically populates for that diagnosis. So it would just be like you were circling it on the super bill, but instead of circling it, you're just going to point and click. Maybe we wanted to order a PSA. Maybe we wanted to order a UA. You've got the ability to do that. You can even give it a specific date. Maybe this is a standing order, so we want to be able to set standing or future orders. You can do that. And keep in mind, anything that's not billed for at the practice would not have a green $sign here, but we're just showing that you're actually ordering it so that you're able to keep track of what you want your patients to have done. Any medications you want to prescribe will go automatically to the pharmacy through SureScript. Any instructions or education, so, maybe today this was a referral Dr. Giorgio and Orlando, and we want to send records back. Keep in mind you could also dictate here. And then this will automatically calculate your E&M code for today's visit. You've got the ability to certainly change that and also look at the details behind that calculation. You certainly don't have to click on this section, but it's just kind of showing you a tool or resource as to where that code actually came from. And then when you're finished, you can click on Save and Sign. You'll notice if you need to come back to that note, you have the option to save it and hold it. That's really important because some of our competitors out there, you have to sign and complete the note before the patient can check out. So you want to make sure you ask that question. With Greenway, you have the option to wait, hold it, sign it off later if that's your preference. So just kind of wanted to point that out. So this is the completed note. Of course, you could route it. You could route pieces of this, so you could generate a correspondence note from here if we needed to as well. Okay, hopefully that was a brief demo. I'm going to go ahead and sign off, and then Dr. Cohen, if you have any questions later, Dr. Salah, look forward to hearing from both of you. Thank you so much for your time.